Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, welcome to another episode of the Egg Whisperer Show, and I'm so excited to bring in the new year with this show. And the title of the show is the Egg Whisperer D.I.E.T. And so I just want everyone to know one thing. My favorite day of the year is January 2nd. Why? Because no one's asking me the most annoying question ever, and that's, so are you ready for Christmas? You know what I mean. It's super, super irritating. And so when January 2nd comes around, I'm like, oh, thank God. I can just celebrate and say, Happy New Year, put everything behind us in 2018 and start fresh. And I can tell you that I get a lot of messages from patients who say, hey, Dr. Amy, remember me? Hey, Dr. Amy, remember me? And of course, I remember my patients. And they use the new year as a time to kind of regroup, get refreshed, get their levels redone, and figure out where they want to go from here. And so if you're one of those people that feels like 2019 is your year and you want to find a good approach to your next steps, well, that's the whole point of the Egg Whisperer diet. It's not literally a diet, and if you know anything about me, the only diet that I believe in is a diet that includes tequila and chocolate. Just kidding. So in all seriousness though, the first step is basically knowing the elements of the diet, and that's diagnosis, IVF, endometrial testing, and your tushy. I'm just kidding. Transferring. And so I'm going to go through all the little parts right now. So let's start with the D, diagnosis. So I keep saying tushy, and you're like, why is she obsessed with tushy? And I just think it's the coolest thing ever because I made a t-shirt for it, and I actually brought a t-shirt to my sister that had the tushy on it. And she thought it was hilarious, and so she wears it everywhere now, to yoga, to the grocery store. So if you want a t-shirt, let me know. I'll hook you up. I know someone who makes them. So the whole purpose of the Tushy method is just to teach people the 5 simple steps that you can do, anyone can do with their fertility doctor, with their OBGYN, to kind of figure out what the D is. So what's your diagnosis? And if you've listened to my shows, if you've listened to my podcast, if you've come to see me as a patient, you know I truly don't think there's any such thing as unexplained infertility. You know, if you're, let's say, 42 years old and you can't figure out why you're getting pregnant, well, you just told me in that sentence you're 42 years old. If you have painful periods, bad endometriosis, and someone tells you it's unexplained, well, guess what? You just described it in your symptoms right there. Well, endometriosis is likely the explanation. But if you're having a hard time figuring out what your explanation is, if you just go through these 5 simple steps, and I'll just show them to you right now. T is for the fallopian tubes. So this is important even if you're doing IVF, because believe it or not, embryos can find their way up in your fallopian tube, and you can even get an ectopic pregnancy in an IVF cycle. So finding out if your fallopian tubes are blocked is a good approach, because if there's also fluid in your fallopian tubes, and this is what a picture of a hysterosalpingogram looks like, that's something you'd want to know before you did a transfer, because the hydrosalpinx, the fluid in the fallopian tube, hydro, water, salpinx tube, that fluid is what we call embryotoxic. It can spill down into the uterus and make that embryo wash away. We don't want that to happen to anybody. The U is for the uterus. So as long as there are people out there that have taken 12 cycles of Clomid and have never had a single ultrasound, I'm going to be shouting Tushy method from the top of my lungs. In fact, I might even dedicate every Tuesday in 2019 to Tushy Talks, where people can call in and tell me their Tushy stories and tell me about their fertility diagnostic tests. And if they feel like no one's given them an explanation, I certainly can help you figure out what your Tushy is telling you. So an ultrasound is so important, because how would you know if you have a fibroid sitting in your uterus or a big cyst on your ovary unless you had an ultrasound? Oftentimes people go to their OBGYN appointment for their quote-unquote annual exam, and during that visit someone is doing a pelvic exam on you where they're taking their fingers, placing them in the vagina, and then pushing on your tummy, and then they're telling you, oh, everything's fine, but there's no camera on the end of your fingers. So a small probe inside the vagina can certainly diagnose problems like polyps, fibroids, endometriosis, so that you're not taking medications for no good reason. So if you have a big polyp sitting in your uterus and you're taking a medication that probably isn't going to help you like Clomid, you'd probably want to find out first. And then there's S. S is for the sperm. Semen analysis are easy tests. They're relatively inexpensive, around $150, and there are a lot of different ways you can do it. You can even do them from the comfort of your home. There's a mail kit that can get shipped to patients' homes. I do that for patients who just don't want to leave their house to do a semen analysis, or their partners don't want to take the cup and drop it off at an appointment. Maybe you live too far from a clinic. But no matter where you live in this country, there is a way to get your sperm health checked without literally leaving your home. And then there's H for hormones. So you've probably seen the website, eggwhisperer.com. But if you want to learn more about how to get your hormones checked, you get your FSH, estradiol, and AMH checked on cycle day number 3 or 1 through 4 in that time range. But certainly there are other hormones that we think are very important, like thyroid and prolactin. And I also do a preconception panel on my patients that includes things like a blood count, a blood type, make sure you're immune to German measles, the chicken pox. These are all part of routine preconception screening and testing. And certainly figuring out if someone has a thyroid problem is definitely something I would want to do as part of my approach to fertility care for people, and as part of the Tushy method for that exact reason. And the last thing is the Y, is your genetic profile. And when you talk to a fertility doctor or your OB/GYN about your family history, certainly when someone says something to you like, I think I want to make sure that you're not a carrier for a certain disease, sometimes that confuses people, and people say things to me like, Dr. Amy, we don't have any diseases in my family. No one in my family, for example, has a disease, cystic fibrosis. I don't need to do that test. But believe it or not, most people that have a child with a disease like that, no one in their family had it either. So it wasn't until the egg source and the sperm source came together and they both happened to share the same mutation, and it's only then that they found out that their kid had the disease. So we can back it up a little bit now with extra testing, and the cost has slowly gone down over time. I remember when I first started doing this testing, it was close to $1,000, and then it went down to $500. And now you can do this test for under $300, depending on the company that you're working with. So while some people might feel this testing is cost prohibitive, the cost has come down, and certainly there are financial programs to help people who can't afford it, so that preconception genetic screening is available to everybody, no matter what your income level is. So those are the steps of the Tushy method, and that is my approach to the diagnosis part of the Egg Whisperer diet. I know, it sounds silly. I certainly am not a cook. I'm not a chef. The only thing I can cook are momlets. Haha, yeah. A little bit of eggs, a little bit of sperm, and then you have an embryo. So I love what I do, if you can't tell. I can talk about this stuff all day long, all day, and I love coming up with ways to make this, what can be quite hard to go through a little bit easier and a little more lighthearted. So thank you guys for continuing to watch and not turning it off with my stupid jokes. So the next part of the Egg Whisperer diet is IVF. So how would you know how to approach your IVF cycle without the diagnosis, right? So you want to go into your IVF cycle with as many answers as possible. So ask your doctor so many questions, and that's my mantra. I have patients that email me and they say, Dr. Amy, I'm so sorry I'm asking you a question. And I said, hey, you remember who you're talking to, right? Ask more questions. And there's even a sign at the front of my office, at my front desk, that says, keep calm and email Dr. Amy. Because if there's a question that you haven't, even if I haven't answered, I always go say, did I answer the question that you were asking me? And if not, ask it in a different way. And certainly my patients are welcome to call me as well and come see me in the office too. So when it comes to designing an IVF protocol, it isn't one size fits all. I get inquiries all the time, and people ask me, hey, do you do birth control pills for everyone? Do you do a day 3 or a day 5 transfer? Do you do a frozen embryo transfer for everyone? And my answer is my approach is different. Certainly, I do enjoy using technology to give patients the highest chance to have a live birth or healthy pregnancy and the lowest risk of miscarriage. And that's what tools like PGTA, or pre-implantation genetic testing for aneuploidy, that's what these tools give us. But certainly not everyone has to use them. But just taking an egg and sperm cell and putting them together and making an embryo and putting them into a uterus Well, just that in and of itself can increase someone's pregnancy rate depending on what their fertility diagnosis is. So knowing what medications you're taking, why you're taking them, how many eggs your doctor expects, how many mature eggs, how many embryos they expect, and why they're choosing the protocol they're choosing, those are all really important questions. I answer those questions for my patients. I actually tell them these things without them even asking. So if you're a patient who doesn't know the answers to these questions before you're starting your protocol, just ask more questions. It's your right to know. You know that saying, knowledge is power, and certainly when it comes to fertility treatment, the more you know, the better. I love it when people come into my office with huge trapper keepers. You know what a trapper keeper is, right? I mean, we're so used to being paperless and having everything on our phones, but a trapper keeper is like a big folder where you can, it's a 3-ring binder and you can put everything in it. I enjoy it when people come in with their binders and they flip through and I say, well, what's your most recent FSH level? And they flip through and say, oh, this was it. And do you have your HSG report? So if you haven't done that, that's something that would be good. Find an IVF journal. There's so many different companies out there that are making things like that to make the process feel so in a process that you have little to no control, because we can't control the number of eggs that you're going, or you yourself cannot control the number of eggs that you're going to produce. You can't turn a bad egg into a good egg. You can just hope that you have the very best eggs in an IVF cycle. If you can't tell, I have a little bit of a cough, so excuse me. But nothing's going to stop me from talking about the egg whisperer diet, not even an annoying cough. I don't know about that. So the E is endometrial receptivity, okay? Let me take another swig of my water. So the E part of the egg whisperer diet is endometrial receptivity. And what does that mean? Well, it doesn't just mean looking at your uterus and looking at the lining of your uterus. I wish it was that easy. But there are really cool tests that you can do that tell us literally how many hours of progesterone your body needs in order for implantation to occur. And everyone's different. In the old days, before I used to do this test, prior to 2013, I used to just put everyone on the standard protocol, and that just means about 6.5 days of progesterone before your transfer date. But what we've learned through trial and error, meaning I actually had patients where they didn't have successful transfers and they came to me as a patient, I did these tests and I found, wow, their window of receptivity was off by over 24 hours. And I made the changes, and then sure enough, the next transfer they were pregnant. Certainly that doesn't happen with everybody, but that's what made me think that this kind of testing is really important to offer patients before they transferred, not after a transfer didn't work. Because if a transfer didn't work, I would be really upset if someone said to me, oh, you know what, there's a test that we could have done first. I would have wanted someone to actually talk to me about all the available testing that I could have done, and then I could have made a choice and said, you know what, I'm going to decline this test. I don't feel like I want to do it right now. I'm going to go ahead and transfer, and then if it doesn't work, then I'll do the testing. So that's my approach. So one of the tests that I do for endometrial receptivity testing is the endometrial receptivity assay. And so this is a test, like I said, that's done after an endometrial biopsy, and I guide a very small catheter into the cavity of the uterus, and I give everyone pain medication, a Valium and a Tylenol with codeine 30 minutes before. I also ask my patients to arrive with a full bladder, and I ask them to drink 2 to 3 glasses of water about 2 to 3 hours prior to the appointment. This way it allows the uterus to lean back. So I describe the uterus kind of like a lawn chair. So when you fill the bladder, it straightens up. So that way when you place the catheter, it goes right in without any difficulty. I count to the number 5, and then the biopsy is over. It's a hard test to go through without pain meds. You know, the uterus is inside the body, and it's a muscle, and if someone stuck a catheter into my uterus without offering me pain meds, I'd be pretty darn pissed. So that's why I feel it's really important to offer women or people compassionate care and to offer them pain meds, and if they choose to decline it, that's okay. But about 98% of my patients are really grateful that they had a procedure that was done with some pain relief, so that they didn't have to have a really horrible experience. The other test that I do is I look for inflammation, endometritis, which is also a form of inflammation in the lining of the uterus, as well as microscopic polyps. And I do that through this test, through receptivadx.com, and then they give me a score. It's called the BCL6 histologic score, and I find that this test also helps me guide patients when it comes to transfer time as well, and the protocol that I use. And that leads us to the T. So the T of the egg whisperer diet. No, it's not. It's not about making a chocolate chip cookie. It's literally about making the best omelet ever. And that's my hope, is that with these 4 elements, the diagnosis and careful planning for your IVF cycle, careful consideration for the best IVF protocol for you with regard to the endometrial testing, so that you're fully ready for the transfer. And on your transfer day, I want you to just rest and relax. And I tell my patients, butt to chair, butt to bed, butt to couch, butt to toilet, and rotate. Or you don't necessarily have to constantly go to the toilet, but I think a lot of people are scared to go pee after their transfer, and I reassure them that it's okay. You're not going to pee your embryo out, poop it out, cough it out, sniff, no, not sniff it out, that's weird, sneeze it out, or laugh it out, and certainly you won't pee it out either. So I want people to just be as zen as possible when it comes to their transfer time. And right now, as you can tell, I have a bad cough. You know, I have patients coming to the office. I think I blame 3 patients right now for giving me this cold, literally. And what I would say is that if there's any doubt, don't do it. So if you find yourself getting sick right now and you're about to do a transfer, I always recommend canceling your transfer. Don't thaw that embryo. You know, get through the sickness that you have and then wait. You can never regret doing that. And my patients who have to cancel for a cold, for example, they always say, oh, thank you so much, because I got so much worse after I canceled. So it's really important to listen to your body. And if you feel like it's not the right time, go ahead and hold off on transferring, because you don't want to look back with any regret. So as you know, my mantra, it's ask more questions. The only dumb question, literally, the only dumb one is the one that you didn't ask when it comes to fertility. This is such a emotionally challenging time for a lot of patients. So making sure that they have someone that will listen to them, who will make them feel like every question is welcome, I think is really important. And there's so many like-minded fertility physicians out there just like me. So please find your fertility team and someone who will care for you in the way that you deserve. And lastly, I want you to have an epic 2019. So if there's any way that I could possibly help you, I welcome you to email us here at the Egg Whisperer Show. It's email@eggwhisperer.com. We'll be doing Tushy Talk Tuesdays. I don't know if I can get this all out. And you know, we have the Egg Whisperer Show Wednesdays. So I hope you enjoyed tonight's show. I hope you learned a lot. I'm happy to hear your IVF stories and help you figure out what your next steps should be with you. And I hope you guys have a great night. So be sure to follow me, subscribe to the YouTube channel, and tune in next week as well. See you soon.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.